Welcome back to Living Local. Death might be inevitable, but that doesn't make talking about those end-of-life issues any easier. And that's why it's so important to discuss a plan for the care of a loved one now rather than later. And that's exactly what we're doing today with the help of Jamie Moen, Director of Home and Community Services, in this segment sponsored by Genesis Health System. Jamie, thanks so much for being here today.
Thanks for having me.
So many people mistakenly believe hospice care is strictly for the end of life, but that's not always the case. What is hospice? Talk to us about that and the misconception that people have when they hear that word hospice.
So hospice is for those that have been diagnosed with a terminal diagnosis. Some might graduate off of hospice, or it might be not be the right fit for them, but most often when you go on hospice, they decide to have us as their support system until the end.
Okay. What are some of the benefits? Talk to us about some of the benefits of hospice.
So when you elect for hospice, that you are surrounded by caregivers, and when I say caregivers, it's nurses, social worker, chaplain, aides that have been through this, know how to navigate the end of life, and can guide you through it and navigate the health system.
Okay, so when should people begin to consider using hospice services? Because we really should be talking about that now versus when it gets closer to time, right?
Yeah, so if you've been diagnosed with a terminal diagnosis, then you should consider hospice and talk to your doctor about it. It's okay for you to bring it up, that if you're no longer seeking active treatment, and when I say active treatment, that's curative treatments.
Okay.
Then you would come on hospice with us. And I would say a misconception, to answer that question, is that we turn everything off. There's no more medication, there's no more food, there's no more fun. And really, hospice is about living.
Yeah.
You're the best end that you can have.
Right, right. And the people that, you know, your loved ones are in contact with too, they really offer, you know, that care too. They're so trained in that area, right?
Yeah, I would say that all of them specialize on helping family members become at ease with the end of life process and understand what's happening to their loved one, so they can embrace it, for lack of a better expression, and then just have that time with their loved one.
Yeah,
the best time.
Talk to us about the difference between VNA and hospice.
So VNA is a skilled service that we have therapists, we have aides, and we have nurses that will come in and will, that is a curative treatment. They'll do therapy, educate you on medications, they do wound care. Hospice, different set of folks, and it's not that curative, it's not therapy usually. And it's more about navigating and keeping you comfortable. So if you have symptoms of pain, shortness of breath, they address that rather than trying to get you stronger, as VNA would.
Okay, do they work hand in hand at all?
It's usually handoff.
Okay.
That you would have VNA, and if you decide that that's no longer what your goals are, then hospice would come in and would take it the rest of the way.
Okay. What kind of things should we be talking about with our loved ones now versus waiting until it's almost too late or till the end, you know, of their life?
Yeah, you never know what day will be your last, whether it's our age or older. So I think everybody needs to have that conversation with their loved ones so everybody knows what your goals are, what your wants are.
Yeah.
It's okay to have that conversation early, and it's okay to change your mind. So I think open communication is so important.
Yeah, but it's so important to do that now, though, right?
Sure.
Now, should folks be putting that in writing?
I would suggest it because sometimes the people change. Sometimes you change your mind, and it's what's in writing is what will be executed most times.
Gotcha. Okay, let's talk about these awards. So Genesis Hospice recently received a national award for the second year in a row. So tell us all about this.
Yep, so these are our 2 quality awards, 2 years running, so we know it's not just a fluke, that this is a trend, that Medicare evaluates what they see as the 7 most important components, whether it's, you know, assessing pain and your goals of care, and we have hit those 100% of the time on a national level. I'd also like to point out that Genesis Hospice is the only 5-star rated hospice in our Quad City area. And there are other hospices, but we definitely, from the voice of the families, they're saying we're 5-star.
That's awesome. Awesome. Great news. Congratulations.
Thank you
as
so much.
well, because like you said, there are other, facilities, other places, but nothing can live up to those 5-star.
Exactly.
Right?
We strive to do our best by our patients and families.
Definitely. All right. Well, Jamie, thank you so much for coming in to talk to us about hospice and educate us as well. We learned a lot today.
Yep. Thanks for the time.
Again, this segment was sponsored by Genesis Health System. For more information, go to genesishealth.com/hospice. And we'll also have all those details posted on ourquadcities.com.